In southern Alberta, there is one OBGYN for an area servicing 100,000 people. Meanwhile, family doctors in Lethbridge are closing their doors to new patients. For more on this crisis unfolding, we are joined by Dr. Stephanie Cooper. She is an obstetrician gynecologist with Alberta Health Services. Good morning.
Good morning. How are you?
I'm curious to know how you and how your clients are doing. What is behind the shortage of OBGYNs in southern Alberta right now?
Well, I'm Calgary-based, so that's the biggest center to Lethbridge and Lethbridge area, and so certainly we're feeling it in Calgary because patients who normally would be seeing their pregnancy specialists and women health care done in Lethbridge area are having to come to the big city, or we're trying to scramble to do remote care. I have a lot of high-risk pregnancy patients and lots of stress there and anxiety about what's going to happen. Certainly right now, I know with just one OBGYN in that area, they really are scrambling to try and find Band-Aid care to bring down, specialists from, other areas in the province, as well as other doctors outside of the province, to bring down just to provide that basic care that's needed for safe pregnancy and even, women's surgery. It's quite distressing.
How did we get into this position?
It's a combination. Obviously it takes a lot to, I guess, recruit specialists to come to rural areas because there's not as much necessarily opportunities for them career-wise, and so there really has to be a lot of support from health regions and from the area to say, what are we going to do to recruit specialists and to keep them there? And the bigger, issue, of course, is what we're seeing all over Canada is family physicians not being available to go to rural areas, funding-wise or opportunities, or support again. And so what's happening, in Lethbridge, again, we had specialists who didn't have family doctors to do basic primary care. So it's a really complicated area that I think is not, Lethbridge is especially hard hit, but that we see all over Canada, where patients, and especially, for me, women in rural and remote areas really are not able to access the same quality of care as they are in cities.
Geographically, just explain for everybody, Dr. Cooper, you're in Calgary, which is about 2.5 hours north of Lethbridge. Yes. And Lethbridge, which has about 95,000 people, also services all the smaller rural communities around it. There were 1,000 babies born in 2021. So what are clients doing this year and into next? And what happens if, in a city the size of Lethbridge, you got 3 babies being born on the same night?
Yeah. So again, right now they are trying to bring in, we call them like locums. So basically, people who don't work there just to come in for short periods of time. Now, they don't know the system. They may not know the staff. They don't know the patients, but they're just coming in to sort of do relief work. I know that they're trying to sort of enhance up the skill set and the training of the amazing labor and delivery nurses that are out there. But whenever anything is slightly complicated, we are anticipating to see a lot more people having to travel to Calgary to deliver their babies, which, with Alberta weather, and we just saw an example of weather already in Canada, that can be even more stressful during the winter, for sure.
Boy, I think about that 2-hour drive on the number 2 highway, and that would be very stressful if you were a soon-to-be mom. You have a new premier in your province. There were new sweeping changes announced to the administration at Alberta Health. What needs to be done for the province now to take care of this?
I think one of the things that seems to be missing from the healthcare changes that are proposed is ways to find and keep the great family doctors that are keeping, this province together through primary care, and suggestions that potentially family medicine visits will come at the cost of a patient is not going to recruit doctors to rural areas, and we need the base of the family doctors to bring the specialists. So, that to me is something that really needs to be readdressed and reemphasized, and have the people in rural and remote areas really stand up and say that we deserve the same quality and safety when it comes to having babies.
I can vouch for Lethbridge. I grew up there, graduated there, started my career there. It's a great place to live. So if you're thinking, if you're a doctor and you're looking for a place to move, Lethbridge is a good one. Dr. Cooper, thanks for coming on today.
For sure. Have a great day.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.